Uganda's population is estimated to be 30 million people, 57% of whom are children aged below 18 years. Over 7 million of the children are orphaned, mainly by HIV and AIDS, yet more than 3 million of them live below the poverty line. Although a good number of non-government organizations are providing various HIV and AIDS-related services in Uganda, such as palliative care, many children end at that and miss out on other opportunities essential for their growth. Against this background, Namugongo Fund for Special Children, NFSC, a community-based non-government organization in Uganda, has opened its doors to this category of children. NFSC was founded in 1986 to give care to handicapped children in Namugongo and the surrounding communities. However, in May 2000, NFSC changed its focus to help orphaned and other vulnerable children reach their full potential through education and other opportunities. To do this noble cause, the organization started out by providing breakfast to 60 children served at one center. This number has grown to 1,500 children receiving breakfast at 7 centers every school morning. A lot of success was registered as many children benefited from these free services, but they were largely restricted to primary school children. With the help of Boston Medical Center, Spark Center, NFSC has introduced a new program to cater for the youths.
This program was initiated in Namugongo Fund for Special Children in 2009, and due to the courtesy of Spark Center from Boston, it is designed to reach the youth who are trying to complete their secondary education. We help them to learn how to work and have hope for the future.
At NFSC, several youths from various schools engage in different activities such as cleaning, vegetable gardening, and livestock keeping, from which they earn a modest stipend. For instance, Katie Nabanova, a student at Mbalwa Secondary School, helps in the cleaning of the breakfast center and serving of breakfast to fellow children.
I am a ticket of Center B. My role at Center B to clean in and out the container. I help the woman to serve the porridge, and I help some people to go and work to some people's houses, like cleaning the compound and washing some clothes.
Kayondo Nicholas is a senior poll candidate and has been on the program for a year. He is one of the ticket children, ticketer. He helps out at Center A with breakfast and the after-school program. NFSC pays him a monthly stipend which he uses to pay part of his school fees every term.
My grandmother's had difficulty in paying school fees, and the money I work, it has helped me in paying my school fees. Half of my school fees, and my mother adds on the school fees. And the money we get from, we have a project, rearing and vegetable growings. So far we had got 18,000, and the money we get, we continue with the project.
Similarly, Walube Karim is a student at John Paul II School. He admits that being a ticketer has enabled him to improve his social interactions.
I've learned how to talk in the public, how to organize my fellow friends at the Center C. We have been taught how to behave well in the society, how to care for our friends, and roughly good manners.
Walube, together with a group of other beneficiaries, are looking after soil which they hope will this year sire about 10 piglets to enlarge their farm.
In a few months, it will give birth, and we know our farm will expand because it always gives birth like 10 of them. So now we are preparing to have a big farm so that it can help us at our centers.
Veronica Mukisa and Tom Yumbia, David Semakula and Ebo Chiza are other beneficiaries of the program. They help in cleaning of the breakfast centers, fetching water and firewood, help the young ones to do their homework, and looking after livestock. The participation in this program has not only helped them socialize with others, but also taught them more skills to look after livestock, even at their homes.
The children do participate in the programs as a team, but headed by a ticketer, and we hope the program will expand when, for example, we have enough pigs who have had many piglets, so that these piglets are distributed to individual homes over the year.
I help in cleaning the container.
At this center, I help to split firewood for breakfast, to fetch water, and to look after children's.
I would like to thank Namgongo Funds for Special Children, friends from SPAC from different centers, and Madame Rosette for caring and love the needy.
Looking after people living with HIV and AIDS is one of the NFSC's projects that it has been doing for 10 years. It continues to do this with the help of Joint Clinical Research Center, JCRC, treat program to provide antiretroviral drugs to the children and their caregivers. JCRC is the country's main HIV and AIDS research center that has helped to supply antiretrovirals to a number of people suffering from the epidemic. Olivia is HIV positive, but also works as a coordinator at Center D in Bulindo. She attributes her good health to the efforts of NFSC.
Namgongo Fund and Joint Clinical Research Center have done much to my life. I'm very fine, as you see me. I'm strong and I can work. I'm very happy with my children, together with my family. I'm doing much to mostly people living with HIV through counseling, teaching, and guiding them.
Of course, notwithstanding the numerous successes and the potential the initiative holds for the future, the process of implementing the program is somewhat challenging and may stall if financial interventions don't come handy.
We just pray that we get other sponsors to come in and they support our program, that we get funds, because without funds, nothing can be done. So we ask for more funds, or request for more funds, so that we make our programs effective.
To support NFSC programs, please visit our website at www.nfschildren.org.